You have normal blood pressure. You have perfect cholesterol. Your doctor says you are the picture of health. You think you are safe, but statistically, you might be walking around with a coin flip chance of a massive heart event. In fact, data shows that nearly 50% of all heart attacks happen to people with normal lipid levels. Why? Because there is one specific number that, if elevated, increases your risk of a heart attack by 4 times. It is a more accurate predictor of stroke and death than LDL cholesterol, yet 80% of seniors have never had it checked. I have analyzed the data, and I have seen the tragedies repeat themselves. Patients who did everything right according to standard guidelines, yet still ended up in the emergency room. Why? Because standard medicine focuses on the plumbing. Is the pipe clogged? But they often ignore the fire. Is the pipe melting from the inside? Today, we are not just talking about another number to memorize. We're fixing a blind spot in your medical care that could save your life. I'm going to tell you exactly what this test is, the controversy behind it, and most importantly, I'm going to give you a specific script to use if your doctor refuses to order it for you. But listen closely, because this marker is tricky. If you test it on the wrong day, after a heavy workout, or even while fighting a minor cold, the results will be useless. This is why many doctors hate this test, because it fluctuates. You need to know the protocol, not just the name. Stay with me. Let's look at a case study. Let's call him Robert. Robert was 68. He was the poster child for senior health. He walked daily, he didn't smoke, and his LDL cholesterol was historically low. His doctor was thrilled with his annual physical. 3 weeks after that perfect checkup, Robert collapsed in his garden, a massive stroke. In the aftermath, the specialists looked deeper. His lipids were fine, but his inflammation levels were exploding. He was burning from the inside out, and nobody looked because it wasn't on the standard panel. The killer in Robert's blood was hs-CRP, high-sensitivity C-reactive protein. Now pay close attention to the HS part. Standard CRP measures massive infection, like if you have a pneumonia or a broken bone. We don't want that. We want high-sensitivity CRP to measure the low-grade simmering inflammation in your arterial walls. Here's the scale you need to know. Ideally, you want to be below 1.0. Between 1.0 and 3.0 is average risk, but anything over 3.0, that is a red alert. Robert's score was 8.2. He was walking around with a biological time bomb and he had no idea. To understand why this kills, you have to understand the mechanism. Think of cholesterol as gunpowder. It is dangerous, yes, but inflammation is the match. You can have gunpowder in your arteries, and if there's no fire, it might just sit there. This is why some people with high cholesterol never have heart attacks. But add high inflammation, that stable plaque becomes soft and unstable. It ruptures. The body panics and forms a clot to seal it. That clot blocks the blood flow. Lights out. It's not the plumbing that failed first. It was the inflammation that caused the rupture. Now, I see the comments on other health videos. I asked my doctor for this and they said no, or they said it's not necessary. This is incredibly common. Many doctors are following guidelines written 15 years ago. They are trained to treat the plumbing, not the fire. So, how do you get the test? If your doctor pushes back, you need to use the right terminology. Say this: "Doctor, I understand it's not standard protocol, but I am concerned about my residual inflammatory risk. I want to know my baseline, and I am willing to pay out of pocket if insurance denies it." Using the term residual risk shows you understand the science. And the science is undeniable. This isn't fringe theory. The landmark Jupiter study followed nearly 18,000 people with normal cholesterol but high CRP. They treated the inflammation, and heart attacks, strokes, and death dropped by 44%. That is a massive number in the world of medicine. A quick note on the calcium scan, or CAC. Many of you ask, shouldn't I just get a scan? The answer is you need both. A calcium scan shows you the history of damage, the old scars. hs-CRP shows you the active danger right now. A CAC scan is like seeing the ashes of a past fire. CRP tells you if the house is currently burning. So, let's say you fight for the test, you get it, and the number is high, say a 5.5. Now what? Before you panic, you need to look for the source of the fire. It usually comes from 3 hidden places. Cause number 1, visceral fat. That belly fat isn't just stored energy, it is an active organ pumping out inflammatory cytokines. Every time you spike your blood sugar with processed foods, you are feeding that fire. Cause number 2, your sleep, specifically sleep apnea. If you snore or stop breathing, you are suffocating your body hundreds of nights. This causes a massive cortisol spike and drives CRP through the roof. You cannot fix your heart if you are choking in your sleep. Cause number 3 is the one almost everyone misses: your mouth. Gum disease. When your gums bleed, oral bacteria leak directly into your bloodstream, your immune system goes into attack mode, and inflammation spikes system-wide. You might not need a cardiologist, you might need a deep cleaning at the dentist. However, we must address the biggest criticism of this test: variability. I have seen comments from people whose CRP jumped from 1 to 20 in a single month. This can happen. CRP is very sensitive. Do not test if you have a cold, the flu, or a urinary tract infection. Do not test the day after a heavy workout at the gym, as muscle repair creates inflammation. And do not test during a gout or arthritis flare-up. These will give you false positives. If you get a high number, do not panic. Wait 2 weeks, ensure you are healthy, and retest to confirm the trend. If lifestyle changes, fixing your diet, treating the apnea, flossing your gums, don't lower the number, medicine has a place. Statins are actually known to lower CRP by up to 50%, independent of cholesterol. There are also specific anti-inflammatory protocols your doctor can prescribe, but you can't treat what you don't measure. So, here's your summary protocol. You might want to save this video or write this down. Step 1. Demand the hs-CRP test. Make sure it is high sensitivity. Step 2. Ensure you are infection-free on test day. Step 3. Avoid NSAIDs like ibuprofen for 24 hours before the test. Step 4. Interpret the result. Your goal is under 1.0. Step 5. Check the big 3: waistline, sleep apnea, and gums. Step 6. Move your body, but don't overtrain right before the lab work. Step 7. Retest in 4 weeks to confirm. Step 8. Pair it with a CAC scan for the full picture. Heart disease is the #1 killer, but it doesn't always strike without warning. It warns us in the language of inflammation. Don't let a normal cholesterol score lull you into a false sense of safety. If this video helped you understand a test your doctor didn't explain, please share this with a friend or family member over 60. You might just save their life. And subscribe to the channel for more life-saving health protocols that go beyond the standard guidelines. I'll see you in the next video.